kids to say children and young people. It's children, but it's children and young people.
How do we refer to young people?
Young people. I'm sure that's the right name.
Adolescents? Because here they're saying adolescents, but I don't.
Hello.
Hello?
Hi. Can you hear me?
Yeah, I can hear you now. Hi, I'm Janet.
Great. Hi, my name is Iris.
Hi.
Hi. The rest also had some trouble logging in. That's why we're all late. But I think they are dropping in now. So
Okay.
that's good. My name is Iris. I'm with the IFMSA. I'm the liaison officer to the World Health Organization. Yeah, super nice to meet you and to have this session with you.
Thank you. Nice to meet you too.
Mm-hmm. Yeah, I think they're all about to join. I see them entering. Here we go. Hey.
Great to meet you.
Perfect.
Hi, everyone.
Hi.
Hi.
Who are we missing? Marie, I think.
We're missing Marie and Laura.
Yeah.
And then I think we'll be okay.
Okay, let me make sure that Marie's access is correct. I know Laura's is, I just double checked hers, and we should be good. Your session moderator is in another session right now, so they'll come straight from that one once it finishes, which should be shortly. So just a heads up there that they'll be arriving soon.
Okay. Thank you for
Right.
us.
Yeah, absolutely. Holler if you need anything. We'll obviously be floating in between. I probably won't come on screen, but I'll be like checking your moderator chats and those sorts of things. So if you run into problems, we're around.
Perfect.
All right. Thanks so much for being here.
Yeah, thank you for all the help and support.
Yeah. Good luck.
Thank you.
Okay, so hopefully Laura and Marie will join us shortly, and then we can just quickly run through the slides. I will be helping facilitate the session, so I'll be clicking through the slides. You can just say next slide, and then I'll go to the next slide. We also have
Amazing.
polls, so I'll have to stop my screen share, switch to the polls, and then go back to the slides. So just bear with me if it's a little slow, but we only have 3 poll questions. And as I said, for your each individual sections, the poll should probably take about 3 to 5 minutes, depending on how quickly people actually respond to the polls, but we'll be able to see the results live. So once we kind of get a critical mass, we'll close the poll. I don't know how many people are joining. We don't get that information in advance, unfortunately. So we'll just have to see once the session starts, and then we'll know how many poll responses we're expecting roughly, because not everyone will participate, obviously.
Yeah.
I saw in one session they had like 80 people join.
Wow.
Yeah, so I think there will be a lot of people.
That would be great. I hope that more than 80 people join, but
yeah, I find like
yeah, and it's also live streamed in addition to that, so yeah.
I have a small question. So do we, like when the poll is happening, do we ask or interact with the poll or just exist?
Absolutely, you can interact with the poll. I think it would be great if you could kind of speak to the results that you're seeing. So if one answer tends to be dominating, then you can speak to it and say like why you think that might is, comment on it. Definitely, I think that would be helpful for the audience. And also Laura will be taking notes because we have to fill out an outcomes form, and so that would also be helpful for her too.
Perfect. Hi, Mary. Thank you.
Hi, sorry, I think I was muted. Hi. So I had some trouble joining, but it worked out now.
Yeah.
We all did.
Yeah.
And I think Laura still has trouble, but I
Yeah,
don't
I'm
know.
just responding to her now. I'm hoping that she can get in.
Yeah.
I don't know.
Thanks for stepping in, Amnea. It's really great that you're here.
I'm so happy when they started the session with NCD Child. I'm like, yes, I'm in.
Always a pleasure. So I was just about. Yes, so Amanda, I don't know if you're just. Maybe can everyone join now, or is it just the speakers that can join?
Hi, I'm Danielle Lachuna. How are you guys doing today?
Hi, good. How are you?
I'm doing well. Does anyone have any questions, or is everyone, you guys are doing all right with everything?
Well, one of our facilitators is actually still having trouble getting in, Laura.
Okay,
So we're just
who would
trying
that
to
be?
troubleshoot that right now.
Are they in our tech room with one of our tech guys, or are they just kind of working through it on their own?
We were corresponding with Ashley, who provided an updated link for us to join. So I'm hoping that she'll be able to get in soon.
Okay. Who are we missing?
Just one, Laura.
Laura.
In the meantime, thank you so much, Amanda, for all the support as well and for creating the slides. Looks really nice.
No problem. I'm really excited actually to listen to what you all have to say. And I think the poll questions will be great just for engagement and just to hear from the audience a little bit more. So actually right now I'm going to copy in how the participants can actually be involved. So I'll intermittently put this back into the chat because it might get filled up with responses or questions. So people always know where to go.
Yeah.
And as I said, I'll show the slides, but then I'll have to stop my screen share and then go back to the polls so that you can see the results.
Perfect.
Can people still sign up, or is it too late?
They can join. They can just join. Or do you mean to the whole summit?
Hello,
Just to watch?
everyone. This is Laura.
Hi.
I'll be supporting with the chat. Have you discussed already on that? Sorry, I was finalizing another one. How do you want me to help you out with the questions and the chat?
I think for the questions, I am sort of like moderating the short Q&A at the end, so I can just keep an eye on what's being put in the chat because I'm not one of the speakers, so I can keep an eye on that.
Okay. We have, if you see in the screen in the right section, we have a chat box for moderators, so we can use that between us.
Perfect.
Are you guys going to be presenting any slides?
Yeah.
Yeah.
So suggestion is that when someone is presenting the slides, please everyone turn off your mics and your cameras because otherwise in YouTube, they will not be able to see the slides.
Okay.
So please be careful with that. And yes, I'll be around just engaging people with the chat also.
And does the speaker who's presenting the slides also turn off their camera when the slides are presented?
No need, but yeah, and if you're going to be speaking, it's fine, but the rest needs to turn it off, yes.
Okay.
And also I'll be, James will be arriving soon and he'll be moderating and sharing with you questions from YouTube. So no worries about that. We will be adding those questions to the moderator's chat.
And what does it mean exactly that he's moderating? Will he also be speaking or?
No, that means that he is just following up the chat box in YouTube because it's live streaming. So if we have some interesting questions or comments in YouTube, we will bring them to this room so you can guys be aware of
Okay, perfect.
anything. Yes.
I'm going to just share my screen now so that we're ready to go. And I'll turn off my video too and my audio.
Laura, what's the link to the YouTube?
I will share it in the chat right now.
Thank you. And are we like just automatically on air 15 past? Is that how it is?
If you see the below in the right corner, it's counting down. So we are counting down to 9 minutes, and it will go automatically, so you can start. People can either join in the web page or also in here in the YouTube.
Can you see my screen yet?
Very small.
So what you need to do is to expand it in the right corner of the screen. You see the icon to expand it.
Like this? Does it expand for everyone or only for us?
No. So I think that's why we need to turn off our cameras so people will focus on that one. But the one that needs to expand the screen is individually. But we see it now.
You can see the first slide?
Yeah. Can you switch to the next one?
That's interesting. I can't see it on my screen. Do you see the trigger warning now?
Yeah.
Yes.
Okay.
We see it.
So I just won't be able to know if you can see my screen. For whatever reason, it's not appearing, but just let me know when to change the slide. And I will.
Yeah, great. But now, Lara, now it's very small, so these, and we all have our cameras off, so just want to check how we can make it larger.
As I was saying, everyone individually needs to expand it. So I can put that message in the chat so that everyone understand that.
Okay, so they personally have to expand it.
Exactly.
All the viewers. Oh, okay.
But in YouTube, they will be able to see it large.
Okay, perfect. Yeah. Yeah, got it. Okay.
Hi, everybody. I'm monitoring the YouTube channel. So what I will do is if they ask questions in the chat there, I will copy and paste them into the Q&A panel on Juno so that you can, and I'll always mark that it's from YouTube in case you want to give a shout out to those people as well.
Thank you.
No problem.
Also, I don't know if you are aware that it is possible that the participants raise their hand if they want to say something. I don't know if you want to give a moment for that, but maybe not. But in any case, you will need to tell me, like, we want to bring this person, this name, and I'll be clicking for them to join in the screen. But I don't know. I would advise to see on time and how we're doing that.
Yeah, maybe just to check with everyone, because we only have 5 minutes for Q&A. So would you prefer that we give them the floor or that I just read out the questions? There's pros and cons to both, of course.
If we have a lot of time, they can speak. But if we don't have much time, I would prefer that you read out the questions so we can.
Yeah, sounds good.
other thing.
Hi team, this is Joseph from Juno here speaking. I just wanted to check in and make sure that we are good to go. Okay, awesome.
Yes.
And then I just want to advise for any moderators that are currently in the room, if you will be a moderator for this room, just be sure to join as an observer so that your page will not be on the screen when it starts. Okay?
Yeah.
Awesome. You guys are going to do really great. I know it. I'm excited for you guys, and I'll be sure to hop in during your session. Best of luck.
Thank you, Joseph.
You're welcome.
Another thing that they have just explained, that also the clock will be counting down on the time that is remaining for the session. But even though it goes down to 0, you will still be in screen live. So just not, I mean, you can try to stick under the time, but if you go, I don't know, 1 minute additionally, it's fine, you can continue. So only until you log out of the session, it will stop.
Good to know, thank you. And Marie, I think you're muted.
How do we log out? Do we just do that by closing the tab, or is there a
Yeah, closing the tab. Yeah, exactly.
Okay, perfect.
Or either you can, there's a button that says exit.
Okay.
And Amanda, when would you prefer for me to announce the Slido? Before every speaker, and maybe announce it in the beginning as well, or did you have another idea for that?
I think that each speaker should announce when their question will be asked, and then I'll copy in that little statement again so they know which website to go to and which code to use. And then you may just need to remind the audience that it'll take a couple minutes for me to share the results on the screen, solely because I have to toggle between windows, and because there's so many people, or there will be so many people in this room, the internet might be slow. Like, I don't know what the bandwidth is for this platform. So just remind them that, it might take a couple minutes to publish the results, but that's what they'll be seeing.
Thank you. So I'll leave it mostly to the speakers to announce the Slido. That's great. All right, 2 minutes. I was meant to ask this. Marie, can you tell me how to properly pronounce your last name?
Yeah, so trying. Hauerslev.
Hauerslev.
Yeah. Well, my name is Marie, actually, if you want to be real.
Marie. Okay.
That's good.
Yeah.
I know all languages. Yeah.
Okay. I'll try to remember this.
Good luck, everyone.
Good luck.
Thank you. You too.
All right. Hello, everyone. Super happy to have you join our session with us today. we're going to discuss the really interesting topic of youth-led health initiatives during COVID-19. We have a slide for you on the bottom right. Whenever you want to see the slide, make sure to expand the screen so you can actually see the contents of the slide. And yeah, we're very excited to get this started. So I'll start off with a trigger warning of this session. So if we can move to the next slide. Yeah, perfect. So this session may have some material that may be difficult to discuss. So these are, we will have some audience polls that we'll be using, and also questions that will ask you about individual health behaviors and risks. To participate in any of the interactive components, so this includes the polls and also the Q&A, do realize this is entirely optional. So don't feel that you have to do that, and only partake if you want to. And then you also have the option to disengage at any time, so feel free to do that. And you may contact the organizers or their support team of this Global Youth Summit at the virtual help desk if you need any support. Thank you so much. So we can move to the next slide to get us started. So firstly, I want to introduce myself shortly. So yeah, I saw in the chat, if you want to see the slide in more detail, you can click on expanding yourself. So feel free to do that. So this is me. My name is Iris. I am a final year medical student at the University of Amsterdam in the Netherlands. And I also have a master's degree in global affairs. I've studied in China for a year. Right now, I represent 1.3 million medical students worldwide to the World Health Organization as the liaison officer to the World Health Organization of the International Federation of Medical Students Associations, or IFMSA in short. And I advocate a lot for meaningful youth engagement. So yeah, that's me. I've been to some meetings and I'm super excited to be in this session with all of you. And now I will go on to introduce in the next slide our really amazing speakers that will be having interventions today. So the first speaker is Dr. Janet Victoria Diaz. She is an accomplished specialist in intensive care and pulmonary medicine with rich expertise in medicine, medical education, training, and quality improvement. She is also committed to promoting the delivery of high quality and cost-efficient care to critically ill patients in resource-limited settings from severe infectious diseases and other serious hazards. Since 2018, she has been working at the World Health Organization as team leader for clinical management and expert network in the Health Systems Readiness Unit of the Health Emergency Program. In this role, she's leading the clinical management response and preparedness to high-threat infectious disease outbreaks, including Lassa fever, Ebola virus disease, and now the COVID-19 pandemic. So she has a lot of experience, especially also with infectious diseases. We're very happy to hear from her. Please do feel free to read the rest of the slide for the rest of the bio as well. And we're very happy to engage with her and hear from her in this session. And I will just mention the very last sentence of the bio, that in her spare time, she travels around the world and is also an avid football fan for her love of ski. So that's also great to know. And thank you so much, Dr. Janet, to be here with us today. If we can move to the next speaker that we have with us. Yeah, perfect. Thank you so much. Next speaker I'm happy to introduce to you is Omnia Alomrana. She's also a medical student in her final year, and she currently serves as a liaison officer for public health issues of the IFMSA. So she's from the same organization that I am, representing 1.3 million medical students from 140 countries worldwide. She's the one that... Oh, you're hearing my voice buzzing. I'm sorry about that. I hope it improves a little bit now. She leads the IFMSA's external work in the areas of non-communicable diseases and climate change. She collaborates with the UN and the WHO, and she's also a commissioner at the Lancet Chatham House Commission on Improving Population Health Post-COVID, and an associate at Women Leaders for Planetary Health. She's currently a member of the United Nations Children's Fund Youth Leaders Program and the Global Youth Coalition for Youth Safety. And for our final speaker, we will move to Dr. Maria Hauislo. She's a Danish physician and the chair of NCD Child. She's the chair of the WHO GCM NCD Lab on Youth and the Next Generation and a commissioner on the Lancet Commission on Gender-Based Violence and Maltreatment of Young People. Alongside her global advocacy and research work, Maria is currently in her formal training in pediatrics at Herlev Hospital, Copenhagen. Previously, as Vice President for External Affairs and Liaison Officer to the WHO of the IFMSA, she was a global leader of the IFMSA's external work, collaborating with the UN, WHO, World Medical Association, and more. She was a driving force behind IFMSA's leadership in the youth and NCDs movement in 2017. She has worked at the WHO Global Coordination Mechanism for NCDs, focusing on children and youth. I'm very honored to have these amazing speakers with us today, and I will move to provide the floor to Dr. Janet for her first intervention.
Okay, hello there. Thank you. I want to thank you for the nice introduction, and also thank you for the privilege of being here with you all. In these busy days and busy times, it's actually refreshing to be invited to such a forum, which is not something common that I get invited to. So thanks again. I was asked to discuss how young people have been affected by COVID-19 globally, directly or indirectly, and how the COVID response will be managed in the future to protect health and well-being. And I'm going to address the first questions. I think I have about 3 or 5 minutes. So if I go too long, just let me know. I can stop. As you guys know, I just looked on the website, right? The COVID-19 pandemic has affected over 144 million people around the world. So that's an incredible number. It has unfortunately caused over 3 million deaths. And it's affecting people in all parts of the world differently, right? In different regions of the world, different age groups are being affected. And I think, when we start to look at this, the effect on people, children, young people, it kind of depends on your phase of life. Like, where are you at in your life at that moment in time? And what we do know, and I'm just going to give you some information, right? So it's difficult, right? It's difficult for all of us at this moment in time. We know that children and young people get infected less often and have more mild disease. Okay, so that's something we've been saying since the beginning of the pandemic, but it doesn't mean that doesn't impact you. It is, we still know that there are some proportion, although smaller than in older adults, that people can develop severe disease and actually in some certain cases death. We know in young people or children as well, if you have risk factors, that's just chronic hypertension or some other risk factor, that like diabetes, maybe you were born with type 1 diabetes, that you also are at increased risk for complications and severe disease. But in general, it's a more mild disease in young people. However, if you do get sick, maybe you're mildly symptomatic, we do know that this post-COVID condition or long COVID can affect young people. We don't know enough to say how many, how much, which age groups are more affected, which genders are more affected, but I think everyone's been reading about that. And so it is a concern because we know that affects people who are not as severely ill, acutely ill, meaning they're in the hospital, in the ICU, but people who have been, mildly ill at home and have recurring or relapsing symptoms that have been described as long COVID. So that's still something to be aware of because we don't know. And I think that affects people of all ages and may affect more people who are younger than older people. So we have still to learn, but I think I want to caution everyone about that. The indirect effects. So let's say you've been infected, but let's say you have not been infected with SARS-CoV-2. You have not developed COVID-19, but the indirect effects of the pandemic have been very difficult for all people. The disruptions in society, which I think as you all have felt, as I have felt, social life, communities, families, education, the ability to go to school or not go to school, go to university, not to go to university, the access to healthcare, So not just for COVID-19, for all the other things that are non-COVID-19 related. This is hugely important. There has been a massive disruption in access to healthcare services. And that has affected all of us, and especially young people who may access healthcare in outreach services that has been reduced, or in normal facility-based services. So that has been impactful. And what has that led to? Again, the indirect impact of COVID-19 may have led to mental health problems. We are seeing that in all in groups. Family violence. So these are the realities of what we have been what people have been experiencing. So what does that mean for us now? You know, I think in every situation, I think the pandemic has challenged us to find opportunities in where we are in life and what we can do. And I will say, for me, example, you know, I came here to work at WHO 3 years ago. I did not think the pandemic would happen the moment I worked here. And the moment I got here, the first epidemic I went to go do response for was an Ebola epidemic in the Democratic Republic of Congo. And then shortly thereafter, this pandemic started. So I found myself in a position that was unexpected. You know, and granted, I'm a little bit older than you guys, but granted, I'm, you know, I've been a clinician already for, 20 years. But still, this was a new opportunity. So it was a difficult opportunity, but I had to live it personally, and as a clinician, and as a public health worker for the WHO. So I think the opportunities for you, especially at any stage in your professional lives that you may be, a student, a young professional in the healthcare field, that how can you contribute to this, right? How can you be part of the solution? Right, the top-down approach obviously is not what we're looking for. The vertical down approach is not what we're looking for. I think the solutions are at the community level. The solutions are at with innovative thinking. The solutions are at with applying new technologies. And I think as I want to kind of close up this is that young people now, as hard as it's been, with the physical distancing, or what people used to call the social distancing, and the isolation, and having to spend time in ways that, you hadn't had to spend time in those ways. I think hopefully within yourselves, as all of us have had to do, you have found some light of how can I contribute to this? How can I try to make this a better, safer place? How can I work with all of those parts of the stakeholders in the community, in the health, in the healthcare field, in the medical sciences, in the research, depending on what your interests are? How can I help in the response? Because I think about my piece of the pie, which is clinical management, COVID-19, but the piece that just one small piece of the pie has to be filled by all of us together, and not just the WHO. Obviously, all members, all stakeholders in the society need to be part of that solution. And I think only together, and the DG would probably say this, in solidarity, will we move forward, and will we learn from this, so the next time, hopefully, we don't make the same, we can do better and ensure equity and good care and safe care and good health for communities around the world. So thank you.
So much, Dr. Diaz, for those very insightful words on what's being experienced right now, and also the role of youth. Thank you so much for sharing that with us. In the meantime, in the chat, you can find a link to the Slido, and right now you can also see the results of the Slido being shared with you of the first question. So please do take a look at the Slido, and also on the insights that are provided by your fellow listeners in this Slido. So thank you so much. Now I will move to our second speaker of today, which is Omnia. Omnia, please, the floor is yours.
Yes, thank you so much for having me in this very exciting discussion. And I would like to share my screen. I have a few slides. So I will try this out right now. Is it working? Can you see my screen?
It's working.
Okay, perfect. So hi, everyone. I'm here on behalf of IFMSA. And in terms of I'm here to share what we have been doing to address COVID-19. And being in an organization that has over 1 million medical students from 140 countries really gave us the opportunity to see what medical students are capable of around the world. And at the same time, how they are at the front line of building the resilience of their communities. And this was really highlighted during the pandemic. In order for us to assess the impacts of COVID-19 on young people, we started by doing a survey that basically asked and specifically focused on the mental health of young people. And we discovered that we had over 1,000 responses, and we held this global survey with 2 other youth-led organizations, and we saw that around 58% indicated that their mental health was negatively impacted by COVID. And this was primarily because of the widespread of misinformation related to COVID and to the pandemic that has been really outbreaking through social media. And this is what also Dr. Tedros referred to as an infodemic. And at the same time, we also saw that they had feelings of tiredness and anxiety, and less than 11% of them had a feeling of optimism during the pandemic itself. So we started by doing the assessment, but then we wanted to take action to tackle the impacts of COVID-19 that is really affecting our demographic. So until this very day, I'm very happy to share that our members in over 50 countries did 113 grassroots activities that specifically focused on COVID-19 and its impacts. On a global level, we had the opportunity to collaborate and start over 20 different partnerships with the World Health Organization, with UN agencies and other civil society organizations. And in these partnerships, we wanted to build the capacity of our members to be able to address the pandemic and lead their own activities. And at the same time, we wanted to really bring in and prioritize the health of adolescents and youth, specifically in the COVID-19 agenda on a policy level. So one of the examples that we did from our partnerships is that we collaborated with UNFPA, as well as Prezi, which is a very cool company that does videos and presentations. And we did a 6-part video series called Youth Against COVID campaign, where we and diverse youth-led organizations drafted scripts and did videos that addressed mental health and COVID, sexual health and COVID-19, as well as how to protect ourselves as young people from the impacts of the pandemic, as well as how to support our communities. And what's very interesting about this platform and these videos, that they had the option to be recreated by young people around the world. We saw that they were recreated in 20 plus languages in 40 countries, and they had over 19,000 outreach on social media. They were practically recreated by young people and shared in their own languages, in their own local contexts, to really empower their communities with the knowledge that they need. But also I have to really highlight what our members and what youth has been doing more on a local level. As I said, we had around 113 activities that addressed diverse aspects related to COVID-19. They also did that through local partnerships, which has been very fundamental in the impact that they have reached. And for example, our medical students in Rwanda, they collaborated with a gender empowerment NGO called Spectra, and they created a lot of materials and spread the right information about how to access maternal healthcare services that was severely impacted during the pandemic. And this was also done, the focus on maternal and child health was really seen in other countries by our members in Lebanon, Bangladesh, and Qatar. On the other hand, we saw that our medical students, for example, in Venezuela, they collaborated with a novelist and graphic designers to do stories on COVID-19 and to answer COVID-19 related questions for both mothers and their children. So these are just examples of what youth has been doing around the world, in addition to many other inspiring activities, that really showed that as young people, we are one of the first line responders to the impacts of the pandemic. And this means that we're very capable of changing the course and really shaping a better, healthier post-COVID world, co-creating solutions with policymakers, and really making the impact both on a local as well as a global level. So thank you, and happy to hear your thoughts about this.
Perfect. Thank you so much, Amnia, for sharing that with us. I believe I can ask Amanda to share the Slido. And Amnia, if you have any comments on the responses that have been given on Slido, we would love to hear. For everyone that's viewing, you can expand the screen again that is now being shared so that you can see what has been responded. And Amnia would love to hear your thoughts.
Yes, so the question was, which of the following topics is most relevant to you and the work that you are doing? It's very interesting to see how mental health has been the most, which has 59% of responses. And this is what we have actually also seen in IFMSA, and as well as many of the events that were done by WHO and diverse UN agencies, is that mental health was a priority that was really highlighted during COVID-19, especially for young people, because of number one, lack to access to mental health care services that was really accelerated and augmented during the pandemic. And at the same time, youth has really, as I explained in the survey, they really expressed a lot of emotion. Mental health, from anxiety to depression to tiredness, because of A, the misinformation, B, the uncertainty about the future, and C, the impact it had on their education as well as the lockdown. And we also saw a lot of impacts related to gender-based violence as well as domestic violence that was accelerating during the pandemic. It's also interesting to see that many of you felt that the topics related to taking action against COVID and gender and COVID-19 related to your work, which was also one of the topics that we tackled in our videos during the Youth Against COVID-19 campaign. So yeah, very interesting to see, and please feel free to share on the chat any links of the work that you have been doing. I'm sure me and all the participants would really love to see that.
Amazing, yeah, and I fully agree on that. Thank you so much, Amnia, for your presentation and also for your reflections. And it's amazing to hear what medical students around the world have been doing. So now for our final speaker, I'm very excited to give the floor to Dr. Maria.
Thank you so much, Iris, and I'll just ask Amanda to pull off the slides. Well, I can start. My name is Marie, and I'm the chair of NCD Child, and we're a global coalition championing the rights and needs of children and youth living with or at risk of NCDs. And NCDs are non-communicable diseases, so those chronic diseases that can that are not caused by an infection and that come up either during childhood or very often in later years in adulthood. But we do see those linkages between your behavior and the way you live your life and the systems that you grow up in, and how that increases the risk of disease and premature death, basically later on in life. And what we're really talking about here is cancer, heart disease, diabetes, and chronic lung diseases, and the risk factors for those diseases are unhealthy diets, physical inactivity, smoking or tobacco use, and alcohol abuse or overuse of alcohol, which lead to those, and air pollution, which lead to those diseases later on in life. And then there is another challenge is that we are also concerned with our children developing these types of diseases early on in life, and the risk factors for those are often different, but there are some of the many same challenges with accessing medicines and care. And what we've really been looking at during this pandemic, and we looked at it very early on with many of the young people that we're engaging with, and is how have these diseases and these, we call them risk factors, but health behaviors, been affected during COVID-19. And we also wanted to make sure that we highlighted and elevated the voices of young people. And this was very early on that we started this campaign called Youth COVID Chat. But basically, and I'm sure many of you will remember that the first 2 or 3 months of the pandemic, we heard a lot of voices of people that were 40, 50 or above, late career professionals, and not many young people were engaged in the conversations. And that's why this forum that we have now is so important, and the whole summit is an incredible opportunity. But we early on wanted to do something to engage the young people. And just to share a little bit with you what the campaign was, we asked people to share how they were, how their health was affected, or what they were hoping to see on the other side of the pandemic. And really, we learned a lot about their stories and experiences during the COVID-19 pandemic at the very early stage. So this was April, May last year. And they did highlight how their health and well-being has been affected. And here on the slide, you'll see the most vulnerable populations. But we do think that children and young people have actually been very vulnerable and during the pandemic, and that many of the measures to contain the virus and the spread of the virus have affected their lives in quite drastic and overwhelming ways. Next slide, please. So just to share with you a couple of the top items or themes that we brought forward with this campaign and this engagement of the young people. And actually, maybe before I go into that, I'd just invite you all to go into Slido, as Amanda is putting in the chat, because we'd really like to hear how you all feel that your health behavior has been affected. And you're more than welcome, of course, to not take part if you are not comfortable doing so. Right. So people were asking, the young people were asking for strengthened health systems to improve health and well-being after the pandemic. And I think that is really clearly that is due to the fact that we've exposed the inequities and the challenges that we have with our health systems, and the fact that many people do not have access to services when we are in such troubled times. And that is not news. That is happening many places all over the world. Also, when we're not in a pandemic, but it was really very clearly seen during the pandemic, and we all remember. And I know that some countries are struggling at the moment as well with the ICU spots, etc. Yeah, and then access to healthcare for all, including marginalized and disenfranchised groups. So that's a bit what I was speaking to before, but really how the people that are at risk or in more vulnerable positions have been, that gap has just been increased, and we're very aware of that, and wish to advocate to create a more equitable world when it comes to health. And then there was a very big focus as well on a rights-based approach to health. So the fact that every child and every human has the right to the highest attainable standard of health, and that is mentioned in several documents. But the one that we are most concerned with is the UN Convention on the Rights of the Child in that situation. So, and as was clear before, mental health has been so put on the agenda, and we also saw a great push and a great attention to the areas of mental health. And a lot of the young people that we're working with have really been quite vocal about that. I think it's something that this is an agenda that we can only lift with the help of young people and our generation. Because not much has happened on mental health, and there is a lot of stigma related, or has been a lot of stigma related to it, that we need to work on. And then at the same time, we also have great challenges with access to services, right? So, and of course, we've seen higher levels of anxiety and depression and gender-based violence and violence in general during the pandemic. So again, we're the pandemic has exacerbated the inequities and the challenges that we already had. And then, so the young people were also hoping to see after the pandemic that there would be a reduction of the existing NCD burden. So using the pandemic as a learning platform to create healthy behaviors and good health systems that can then both prevent and control NCDs in the post-pandemic world. And unfortunately, I think we're seeing things going both ways, and there are definitely also challenges during this pandemic with increasing obesity, alcohol use, tobacco use, etc. So it is not going only in the right direction. Yeah, next slide. Thank you. And can we go to the Slido, and then I'll just comment briefly on that. Thank you so much, Amanda. So let's see here. Yeah, so what we asked you all was which risk behaviors or coping mechanisms have you engaged with as a result of COVID-19? And here there's the winner is the excessive social media and use and screen time. And I think a lot of us can relate to that. It is also the fact that we are having teaching and home office or office from home. And I think that is one thing that is important to mention. And when we talk about children, they have also had much more sedentary behavior, more screen time, and that all leads to, and we have seen increasing weights of children, so increasing levels of obesity as a result of the pandemic. But what is also a bit striking here, I think, is that the second position is really, I have engaged in 2 or more of the above risk factors or coping mechanisms as a result of COVID-19. And those include over or under eating, negative self-talk or self-harm. Yeah, so that is very interesting to see, and I think it speaks to a lot of us. And I believe it was only 6% that have not do not feel that they have engaged in any risk behaviors, and that is a very low number. So yeah, we're just all struggling, and we need to stand together to create a healthier environment for all of us at the end of this, and hopefully also during, especially if the pandemic keeps challenging us for years to come. Thanks, Iris.
Amazing. Thank you so much for sharing those incredibly important insights, and also for everyone taking part in the Slido. It's quite shocking, but also very important for us to realize this impact. So now I will go on to the Q&A. If you have questions, please do not hesitate to put them in the Q&A. We got a lot in already, so I will quickly get started. So I will start off with a question to Omnia. It's actually 2 questions combined because they were very similar. So I have a question from Mathieu, which is, how can we provide mental health assistance at such a high skill? And that's actually very connected to a question that Lara mentioned, and apologies for any of the listeners if I mispronounce your name. She asks, what mechanisms do you believe can be followed to soften the impact of the pandemic on mental health?
Yes, thank you so much for your questions. And I think for us in IFMSA, we really had the capability of addressing mental health because of our network, our widespread network. And right now we live in the digital age. So it's very, easy, and it's very accessible for many young people, and for us to bring in experts that we work with through our partnerships, as well as doctors that we know, and try to bring in their expertise to our members to really build their capacity to be able to talk about mental health issues and communicate communicate the best coping mechanisms with that. That is why, for example, at the same time last year, we collaborated with the UN Secretary Envoy Office on Youth, as well as UNICEF, and we did a series of webinars, of 9 webinars that really focused specifically on mental health in young people. And what was very unique about the webinars is that we invited young people to share their own experiences, to share their own struggles and the needs that they want. And because what's very important in terms of coping mechanisms is to speak out and to really express how you feel. With COVID-19, and as you all shared in the poll, one of the biggest impacts that really affected our mental health was the excessive use of social media and very less time spending with, for example, family, friends, and communicating with others, even through a simple phone call. And that's why it's important to speak and to connect with, given the circumstances of COVID, this was the challenge. But as young people, we found ways around it. And we especially also did that in our own organization. We had the opportunity that even though we used to meet every year with a conference where we had over 1,000 medical students join around the world, this did not stop us to do it anyways and have it virtually. And we had over 2,000 medical students join in because right now it's even more accessible. So it's very important to communicate, to try to connect with others. And we're all also experiencing the same thing, and you will find many others having the same feelings. And that is why, for example, the campaign by NCD Child really showed that young people have similar needs. So I hope this answers your questions.
Thank you so much, Amnia. While we're at it, I will ask someone from the NCD Child team here to put a link to your social media in the chat, because someone has asked for that. In the meantime, I have a question for Dr. Janet. Martin has asked, do you think world leaders and humanity in general will learn from this pandemic to be more responsible or handling the prevention of other pandemic happening? Considering that some people have warned that we're not ready for a pandemic, but have ultimately been ignored. And do you think if they implement some preventive measures, will they be kept up for long enough and not disappear within 5 years? I think your perspective also for within the WHO would be very beneficial. Thank you. I believe you're still on mute.
It's a very smart question. It is the question I think we're all asking ourselves. I would have to believe yes. I am an optimist at heart, and I have to believe in humanity learning from its mistakes, although humanity over time has repeated some mistakes over centuries. We know that. But I think from this one, we have to learn, but it's a learning that has to happen at all levels of society. There's those of us that are mid-career, let's say me and my colleagues that are, very active in the response. There are those that are later in their careers, and then there's you, the youth, the young people, right, that are earlier in their careers, earlier in their lives. And having lived through something like that, I think at that point in your life, then I think we all have to make a difference. We all have to absorb what's happened, hopefully not absorb, forget, move on, and pretend it didn't happen. We actually have to take it with us. And then how do we change, And I think from the WHO perspective, I have to have hope that we will reorganize ourselves, reorganize the global strategies with other international stakeholders in order to put in programs of readiness and preparedness that never find us in the same situation as we were this time, because we have learned. But that probably is not going to be sufficient. I really think that we all have to take responsibility. And I think I would call on young people at the different career paths, those that are in health professions, public health, whatever it is that you're studying, data, analytics, AI, I don't know, that we now have to build a different future together. And I do think there is a call for action on all of our parts in order for this not to happen. I think if we all turn an eye and say, okay, let's go back to what it was before, then of course it will happen again. But I believe that all of us have learned so much from this, and some of us in harder ways than others, because the lessons have been hard for many of us, for many, potentially for our loved ones as well. But we have to learn from that and then say, how can we all do better? And everyone has a role in that. So I am positive and hopeful for a better future. So thank you.
Yeah, thank you very much, and I'm hopeful with you. so hopefully we do learn a lot from this situation, and also let's make sure that we personally integrate those lessons in our actions. So now I will move to Dr. Maria. There's actually 2 questions that are specifically for you, so I will touch upon both of them and see if you can answer both. So the first one is, how did you achieve to get people involved in social media without putting integrity and safety of the young people who participated at risk? That's a question is asked by Fernanda. And the second question is from Tarishna, which is, do you think that therapy sessions can be done online, and will they give the same impact as a physical one? I'd love to hear your perspective on these 2 questions.
Thank you, Iris, and thanks, Fernanda and Tarishna. I really appreciate those questions, and I think they're very very concrete and important. So about our campaign, the people that we engaged sort of to begin with were very much people that we were working with already. So they knew us and they trusted us. But at the same time, the way we did it was that they submitted a photo of themselves and a statement that they decided on themselves. So we were not exposing or putting anything out there that was not what they wanted. And it was only an opportunity. It was, of course, it was nothing that we said anyone had to do. They decided themselves what kind of messages they would like to share with the world. We were just providing the platform, really. And I think that is one thing that we think is important, is to be a platform to elevate youth voices. And we also did not censor. There were not some that we did not choose to put out there. We shared everything that was shared with us. So that is how we did it. And we also went through them, of course, but we did not feel that anyone were risking their safety by sharing what they did. Yeah, and then we only engage people above 18 in these types of campaigns because of those types of challenges. Yeah. When we engage children, we always have a parent with them, but that is more something that we do for our physical events. And then about therapy sessions. So this is more, I think, me as a clinician and as a doctor, and I think that they can be done online, and I think they can be very effective online, and I think a lot of people can benefit from that type of management of mental health challenges. But I do not think that they are the same as being in a room. So I think we've gotten really good during COVID at these types of things, and also having camera on more, and we can interpret each other's faces and gestures and so on. But seeing the body posture and how people are they handshaking when they're saying something, you can't see as much on the camera as you can in person. And I think also that connection between a therapist and the person receiving the therapy, I think that is much more better and I think comfortable in a room rather than on an internet connection. So that would be my answer to that.
Thank you so much for giving insights on both of those questions. So we're heading into our final 2 minutes. There are a lot of questions left, but unfortunately we do not have time during this session to touch upon them all. I would encourage you to keep engaging with us. Social media channels have been shared already, and also, of course, this is the start of the conversation, not the end. So thank you so much for being so involved and engaged within the whole session. Now I would like to go towards closing this session with you, as we have 1.5 minutes remaining. Again, I want to start by thanking the speakers on providing such really integral and insightful points during your interventions and during your answers to the questions. I personally learned a lot, and I hope all the listeners did as well. So thank you so much for being here with us. Then I would also like to thank some people that have been working really hard behind the screens. So first of all, I'd like to thank Amanda and Laura, and I think even more from the NCD Child team, who have been really integral in putting all of this together. If you are here and you can put your camera on, please feel free to do so from NCD Child. I would also like to thank Ashley and Hannah from the Global Youth Summit team. who have been really helping us out throughout this whole journey. And I think right now also Joseph, Laura, and some other people from Juno and helping us with the platform. So thank you so much for being here with us. And with my final words, I would really like to say that youth, it's a very specific demographic, and we're experiencing this pandemic in a very specific way. We're also a very large demographic. We're a very large part of this world. And what we experience is important, but also what we do is very important. And what we can make happen is very essential. So I hope that you have an amazing time at this Global Youth Summit, and you will be inspired please keep doing what you do and make change in this world. Thank you so much for being here with us. And thank you everyone for making this session to reality. Bye-bye.